There's this sense you get with a few patients or a lot of patients where I guess it's when you know they trust you, or when sometimes you know that that's all they can do is trust you.
It's a big responsibility. You're going to be basically taking them apart and putting them back together. People are putting their life and their health in your hands.
Our jobs as plastic surgeons are about reconstruction and about restoration.
Our goal is to get patients healed, get them through the experience, and make them feel like themselves again.
Unfortunately, cancer treatments and the consequences of trauma can leave patients with long-lasting effects.
If you've lost both of your breasts to breast cancer and you haven't had reconstruction, every time you get up in the morning, look in the mirror, you're reminded by that. It's a constant reminder. So our job is to try to take some of that away so they're not thinking about it constantly.
In order for you to be able to offer them a solution, you need to be able to understand them more than just a problem. You need to see them as a person.
They want you to be human with them.
When you come into our doors, you quickly get to know not just the physician, but you get to know Ashley or Jenny at the front desk. You get to know our schedulers. We have an amazing office manager, Liz, who is the centerpiece of all of that care that's the ongoing care.
I have my own personal stories with cancer, and I know what it does to families and to people that are going through it. We are working really hard on developing a really strong team with a really strong team mindset.
It's not just a textbook of operations. You really have to solve problems.
Everything that we do is measured in millimeters.
We're using one's own tissues to be able to heal itself. And so the ability to move those tissues from one place to another gives us the versatility of treating things that were never able to be treated before.
So some of the big reconstructive cases we do with 2 surgeons. And it's nice because we all are interchangeable and we work seamlessly together.
We have all the resources that are necessary to provide true multidisciplinary care that's under the same roof. The more people that you can rally around you, the better that the patients do and the faster that they recover.
We are the front runners for lymphedema treatment. Dr. Klein has pioneered that, and we have a whole team centered around that. We're always looking to do the next best thing, not just because it's the neat thing to do or because it's been in the news, but because we think it's going to advance patient care.
No matter how complex the issue, or no matter how difficult a patient's case may be, we're able to take it on.
We develop these tools, we fine-tune these skills, we become more efficient, we minimize the risks, and then all of a sudden you realize that's the easy part, and now you have to get the patient back out there.
The best thing that we can give is hope. The relationship where you do provide that hope is the first step to healing. Being part of that journey has to be the most rewarding portion of our job.
I guess I rebuild what's been torn down. I reconstruct.